Alright, part 2 of the endocrine system, endocrine cells of other tissues and organs. Well, you've got some skin that can play some role. That's cholecalciferol. The liver, angiotensinogen, calcidol, hepcidin, insulin-like growth factor, IGF. Kidneys, renin, EPO, we talked about EPO, calcitriol, vitamin D3, very important. You're probably lacking vitamin D3 right now since you've been stucking at home. So heart, natriuretic peptides. So these are some other endocrine cells. Stomach and small intestine secrete enteric hormones, gastrin, CCK, ghrelin, peptide YY. Adipose tissue itself can secrete leptin. Placenta can secrete estrogen, progesterone. Osseous tissue secrete osteocalcin. Oops. Development of the endocrine glands. Well, the endocrine glands develop from the epithelia. The pituitary, the adenohypophysis, develops from the ectoderm of the pharynx. The neurohypophysis develops as a bud off the hypothalamus. Thyroid gland grows from floor of the pharynx, migrates posteriorly. So again, at 4 weeks, 5 weeks, 7 weeks, look at this. Again, I can't stress enough the first trimester. We've done that. That's a common theme around the whole semester. But look at all these important glands and organs and structures that develop in the first 4, 5, 6, 7, 8 weeks, right? First trimester. So very important. All right. It's well known that alcohol can affect your health in a number of ways, such as decreasing your risk of heart disease and stroke if consumed in low doses and damaging your liver. But scientists have known for decades that alcohol also has widespread effects on the endocrine system. For example, alcohol can impair the regulation of blood sugar levels by interfering with certain hormones, reduce testosterone levels in men by damaging the testes, increase the risk of osteoporosis by messing with calcium-regulating hormone called parathyroid hormone, according to the National Institute of Alcohol Abuse and Alcoholism. So, moderation is the key. What they found, and they remember they recommended a glass of wine a day. They said that that's beneficial, but what would happen was they found that women, once they started drinking, they instead of drinking 1 glass a day, they would finish half the bottle, and that occurred on a regular basis. So that's a little excessive. Remember, they recommend moderate alcohol consumption, not a whole bottle. All right, aging of the endocrine system, adrenal, thymus, and pineal glands all shrink in size early in life. Okay. Insulin secretion effectiveness decline in old age. Ovarian decline at menopause increases risk of cardiovascular disease, osteoporosis, and dementia, but they've linked taking birth control to decrease ovarian cancer risk. But then there's the caveat of that sometimes there's an increase in breast cancer, so it's like a catch-22. Thyroid effectiveness declines in the elderly and less target cell ability to convert T4 to T3. Again, this is more physiology stuff. I just need you to know what are the organs and some of the major aspects of the endocrine system. Endocrine disorders. Hormone disorders can involve secretion, hypo or hyper secretion of receptor defect. Endemic goiters can result from hyposecretion of thyroid. This increases TSH secretion and leads to hypertrophy of the thyroid gland. Cushing syndrome caused by cortisol hypersecretion disrupts carbohydrate and protein metabolism. Alrighty, so let me show you what an endemic goiter looks like. So that's what an endemic goiter looks like right in here. And this usually occurs in areas where there's iodine deficiency, China, India, but it could be in the United States as well. So why do we have iodized salts? Well, basically, one of the main reasons we have iodized salt is to prevent endemic goiters right here. So it's as simple as iodine deficiency, putting iodine in salt, and you prevent this. All right? So there is benefit to salt. Now, Cushing syndrome. So they're due to excess cortisol-like medication, prednisone, or tumor that produces or results in production of excessive cortisol. So you get a moon face, dark facial hair, cardiac hypertrophy, obesity, abdominal striations or shoulder striations, amenorrhea, women, poor wound healing, muscle wasting extremities, hypertension, osteoporosis, and they have this and large supraclavicular fat pads right in here. So that's Cushing's syndrome, and that's caused by excessive cortisol. So you hear about cortisol a lot, and weight loss, weight loss, weight loss. So why do diets fail? Well, whether it's keto, paleo, Atkins, low fat, low carb, intermittent fasting, etc., etc., basically it all comes down to caloric deficit. Or does it? Well, the rule of thumb is you take your body weight and multiply that by the 1012 for caloric deficit. So if you weigh 150 pounds, you should eat about 1,500 to 1,800 calories if you want to lose weight. But what happens if you do that and you still can't lose weight? Well, then the endocrine system is to blame, usually, right? You gotta blame somebody. Well, so there's different kinds of body fat distribution. You're either an apple-shaped, you're an inverted triangle, you're either a pear-shaped or a rectangle. Okay, so you're usually one of these shapes. So how do you determine the body shape? That's the waist-to-hip ratio. That's your waist measurement to your hip measurement. So you divide your waist by your hip. Okay. So if you're an apple, that's weight accumulates around your hips and your abdomen. You have an increased risk of cardiovascular disease, type 2 diabetes, elevated blood pressure. This usually indicates lifestyle imbalances such as high level of stress, poor diet, and very little physical activity. In men, particularly, excessive consumption of alcohol has been linked to the development of an apple-shaped. Avoid the mid-afternoon snacking if you're apple-shaped. Apple-shaped people will benefit from diet rich in protein and fiber and low in carbs. Also add some spices like garlic and chili, as this is shown to speed up some metabolism. So also exercise, cardio with a combination of weights. So if you're apple, that's usually women greater than 0.8 of your waist to hip measurement. And then men, it's greater than 0.9. Okay. If you're pear-shaped, fat is deposited around the thighs and the hips and butt. So your upper extremities are real thin. More difficult to lose weight. Unfortunately, you have an increased risk of developing osteoporosis. Good news is that weight carried around your bottom and thighs is due to subcutaneous fat rather than more dangerous visceral activity. So pear-shaped people are significantly healthier than those that are apple-shaped. Fat deposit on the hips is less likely to travel around the body, reducing the risk of heart disease. Further, the risk of stroke and diabetes is not elevated by the pear-shaped body. Higher estrogen, therefore higher risk of breast cancer, though, so check monthly. For these individuals, you should do more leg exercises, compound lifts, deadlifts, squats, and running. Eat regularly, as pears have a tendency to emotionally eat more due to stress. And how do you know if you're pear-shaped? That's if your waist-to-hip ratio is less than 0.8. And then for men, it's less than 0.9. If you're inverted triangle, so you have broad shoulders but a narrow waist, good metabolism, do not put weight on easily, you have an increased chance of developing osteoporosis. People who have this body shape do not gain weight and fat easily. And also when dieting, they are much more effective at weight loss. If triangle-shaped people eat a diet laden with fat, though, they are more likely to be diagnosed with heart disease. In addition to that, people whose body shape fit this category are also at greater risk of developing osteoporosis. It's a good shape to be in, though. With a large proportion of muscle and good weight to height ratio, the triangle shape has a high metabolism. So how do you balance out? You build your glutes and thighs and eat more poultry and fish. What if you're a straight rectangle? Straight body shape, hips and bust are balanced. Higher metabolism, don't put on weight easily. Rectangle shape tend to have a higher metabolism, don't gain weight easily. The key is to keep an eye on calories in and out. Add some curves, do some shoulders, and some glute exercises. Okay, so you can round out a little bit. So there you go. So of these, the most dangerous one is probably the apple-shaped. So if your waist to hip ratio is greater than 0.8 for women and greater than 0.9 for men. All right. So that's a little FYI. If you've tried every diet and you can't, unfortunately, lose the weight, then might be more to it, and you might want to see an endocrinologist or take some of this advice and see if that works. So what does BMI really, does that really work? So these women are all 70 kilograms, 154 pounds. Okay, so they weigh exactly the same. But she's 4'9", she's 5'7", she's 5'5.5", 5'8", 5'5", and 6'1". Okay, so again, they all weigh 154 pounds. but you can see the variance in the body shapes at 154 pounds. So sometimes we just look at weight, and you can clearly see that 154 pounds is clearly different on every individual. It depends on the height, depends on the weight, depends on the BMI, all that stuff. So, for example, she weighs 154 pounds, but she's at 33 BMI. This is a high risk of heart disease and diabetes. Okay, but she weighs 154 pounds and she's 6'1", so her BMI is relatively low. So those are some things that you want to consider: height, weight, and everything. So, here's a good body shape indicator. BMI is a misleading indicator of obesity. Several influencer factors such as weight, distribution, and gender are left out from its calculations, which make the BMI predictions of mortality unreliable. So a lot of life insurances use BMI, but it's really unreliable. Waist circumference is already seen to be a better predictor. But here's a good one. It's called absicalculator.eu, and you can kind of see what your true BMI is. Here, there's a little calculator for you. All right, top 5 reasons due to endocrine system. So you can get some insulin resistance. Insulin is produced in response to food intake, with higher carb meals causing a greater increase in insulin. Hormones in our body must bind to receptors. If levels of any hormone, including insulin, is too high or for too long, you end up with resistance to that hormone. That means your body will pump out even more insulin in response to the same type and amount of food. So how can you lower your insulin? Decrease your intake of carbs, and particularly simple sugars. Exercise, particularly resistance exercise, will improve your insulin sensitivity, making fat loss easier. Nutrients such as chromium, magnesium, and berberine may also help improve insulin sensitivity as well. So diet and exercise. Diet and exercise. You'll see a common theme. What if you have a poor gut, poor digestive health? Every nutrient in the body must pass through the GI tract. Every nutrient. Therefore, poor digestive health can lead to cellular malnutrition in the body tissue. In addition, certain bacterial imbalances can lead to greater caloric extraction and therefore weight gain or difficulty losing weight. Other problems that include gram-negative bacteria, including lipopolysaccharides, into the bloodstream. This can lead to thyroid hormone resistance as well as increased cortisol and insulin levels. What about chronic infections? Surprisingly enough, the connection between acute infection has been known for almost 26 years. Viruses, bacteria, and fungal infections result in what is known as a cytokine storm. Cytokines are molecules produced by immune cells. There are pro-inflammatory cytokines and anti-inflammatory cytokines. In an acute situation, pro-inflammatory cytokines are beneficial as part of the immune response. However, with chronic infections, they rarely get turned off. So cytokines are those molecules that make you feel as if you've been hit by an 18-wheel truck when you have a cold or the flu. And so those that are having symptoms of COVID-19, that's usually a cytokine acute response. The most notorious of this are interleukin-6, interleukin-1 beta, and tumor necrosis factor. They result in surge of cortisol being produced, which is described above, contributes to insulin resistance. What's the long-term solution is this: to address the infection with the appropriate nutraceutical through diet, prescription drugs when required. What about sex hormones? Sex hormone imbalances. So far we discussed cortisol, insulin, and DHEA. Typically, this is where hormone imbalances first show up. However, if these are not addressed, downstream hormones such as testosterone, estradiol, progesterone, and IGF are impacted. Testosterone, while higher in males, is also needed by females for energy and sex drive. In addition, it helps to build and maintain lean muscle mass. If you are deficient in testosterone, it can lead to a net catabolic state in which your body is breaking down muscle tissue, and you will have trouble recovering from both exercise and injury. Estrogen, while predominantly a female hormone, is also needed in small amounts in males. Estrogen dominance can develop in males and females. In males, it generally means your estradiol or E2 is high relative to your free and total testosterone. It may lead to extra fat around the chest, so you might see that. In females, the E2 progesterone ratio must be examined. In most beneficial medicine circles, you want this number to be above 400. Estrogen dominance leads to difficulty losing weight. How does one become estrogen dominant? There are a myriad of causes, including poor gut health, certain genetics, and inflammation. In females, estrogen dominance can result in mood changes, trouble sleeping, and menstrual cramps. One important note is that estrogen can increase thyroid binding globulin, which results in less available free thyroid hormone. So, It's not always about weight. Look at this. She weighs 63 kilograms here in 2009. Here, she weighs 66 kilograms, so she actually weighs more, but she's more lean. Muscle weighs more than fat. So the bottom line is, don't get caught up on the number. We got to look at the whole picture and the whole patient. Okay, so, all right, so hopefully that helps.